Okay, so today we are seeing a patient named Jake. He's a 17-year-old male. He recently had a patellar fracture and he's been in the cast for 6 weeks. He just got it removed yesterday. So most likely he is out of the fibroblastic phase of healing, where pain and inflammation begin to decrease and we have a gradual return to function. This can take up to 6 weeks. Likely he's in the maturation or remodeling phase of healing, where scarring has occurred and we can focus on increasing strength and returning to normal function. And this can take up to 2 years. So some indications or reasons we would want to use heat on a patient include decreasing muscle pain and stiffness, decreasing muscle spasms, increasing range of motion, increasing circulation and nutrients to the area, or if we're dealing with subacute sprains or contusions or inflammation. Some contraindications or reasons that we would not want to use heat on a patient include if the injury is acute, if there's hemorrhaging, if they have impaired sensation, if they have impaired circulation, or if they have peripheral vascular disease. Some precautions or things that we would want to look out for when applying heat to patients is if they have impaired mentation or communication skills, if they have impaired thermoregulation, if they have cardiac insufficiency, if they are pregnant, which we don't expect with Jake, or if there have been topical counter irritants applied to the same area. So let's go see Jake and see how he's doing. All right, Jake, so we just got your cast off recently, I understand, and we're gonna actually try to do some exercises and stretching today. So I wanna increase the responsiveness of some of your tissues. We're gonna try to get some range of motion back and try to kind of loosen things up. So I'd like to warm you up with some heat before we start. Does that sound good?
Yeah, it does.
All right, so I have this heat pack here. We got a couple towel layers here. So the heat pack is really warm. You know what, actually before I do that, I'm just gonna make sure, since you've been in the cast for a while, just let me know if you can feel my finger touches, okay?
Oh yeah, I feel
that. Feel here?
Yep.
Feel here?
Yep.
Feel here?
Yep.
And how about there?
Yep.
Good? All right, everything else looks good. So I'm gonna put the heat pack on. There's a couple towel layers, so it will take a moment for the heat to get through. Okay. But it is really hot, so it will get through. So I want you're gonna expect to feel some warmth, like I said, in a few minutes. If it's too hot at any point, I'm gonna leave a bell for you. You can ring, you can holler at any of us. And if we don't show up in time and it's too hot, please just take it off. This shouldn't burn you, but like I said, it will be warm. Okay, so I'm gonna leave this bell here for you. I'm gonna set a timer for 5 minutes. I'm gonna come check on you after 5 minutes, and then we'll probably go for another 5 to 10 after that if it still feels okay, all right?
Okay.
Sound good? Does it feel okay on your knee?
Yeah, it feels good.
Okay, I'll be back in 5 minutes, all right?
All right.
All right, 5 minutes is up. You still feeling okay here?
Yep. Yeah, it's starting to get warm.
All right, perfect.
Doing what's supposed to.
All right, I'll leave you for another 10 minutes.
Okay.
Come back. All right. Now that you're nice and toasty, how's that feel?
That feels a lot better.
Good?
Thanks,
Didn't
buddy.
get too hot?
No.
All right, everything looks good. Now we can start with your exercises.
Awesome. Thank you.
All right, no problem.